And welcome back. People have been enjoying the benefits of weight loss drugs on the market, with some even turning to the copycat versions, hoping for the same effect. And that's the result of a shortage. However, doctors are concerned after 10 deaths have been linked to those alternate versions, along with at least 100 hospitalizations in the past 2 years. Dr. Danish Ali shared why those drugs can be dangerous.
These medications, especially the formulations of semaglutide, received lots of positive feedback. They helped a lot of people lose weight. Some folks, Isaiah, believe it or not, their diabetes went away. Their numbers improved so significantly. These patients that I've seen were on multiple blood pressure medications, and they were able to get off of that with all the weight loss that they experienced. But with that, Isaiah, we also saw that this medications gained so much publicity. They were classified as shortages, which means that other pharmacies, specifically like the compounding pharmacies, the specialty pharmacies, are able to make their own renditions of these drugs.
And we're talking about like the Ozempics, the Wegovy's, those medications that are so popular right now.
Yes, exactly, Isaiah. And since 2022, specifically, the Ozempic has been under a back order from the manufacturers, which is Novo Nordisk. And when that happens, the FDA gives some freedom for specialty pharmacies and compounding pharmacies to be able to produce their own rendition, their own version of the generic or the semaglutide. And that's what we are seeing now, is some of those renditions have had some side effects. There have been maybe possibly some dosing errors. And so we have seen some hospitalizations increase as a number of folks that are being hospitalized due to complications with taking the specialties or compounded version of this medication, that they've ended up in the hospital. And so far to date, we've seen over 10 deaths associated with this as well.
And I want to make it clear, we're not talking about the name brand drugs like Ozempic and Wegovy causing these problems. We're talking about essentially what I would call clones that are made by, allowed to be made by, compounding pharmacists, pharmacies out there, right? It's not the name brands.
That is correct, Isaiah. We do know that there are side effects associated with the Ozempic and the brand names as well. However, we haven't seen such a high number of hospitalizations and even deaths associated with the brand names, or the ones that are more FDA regulated. What happens is with these specialty pharmacies, Isaiah, is that this medication specifically may not be tested and may not be fully FDA regulated by the compounding pharmacies. And so it doesn't go through the same rigor and same testing that the brand names and some of these companies like Novo Nordisk go through in order to get this drug on the market. So our suggestion in the medical community overall is to avoid as much as possible the compounded versions or the versions that may be from specialty pharmacies, unless you're able to really know for sure that these medications did undergo testing and that they have been quality tested and also gone through some rigorous testing from a pharmacy standpoint to make sure that you can prevent some of these side effects and hospitalizations as well.
All right, Dr. Danish Ali, Arch Point Pain Institute, thank you for joining us here on The Factor Uncensored with some important information about a very popular drug right now. Thank you, sir.
My pleasure, Isaiah.